We are into medical, so we will love Grey's Anatomy. Go for other courses as well, which definitely are diploma, fellowships, and one which I have done. I joined it based on somebody's recommendations only.
Uh-huh.
That doesn't
Uh-huh.
happen in real life. Some of my colleagues have also faced an issue where they have been given notice by a dermatologist. There is competition in small cities. It gave me both clarity and direction. They are like, મેડમ આ તો પાછું થઈ ગયું હવે શું કરવાનું. As a MBBS doctor, I can treat each and every kind of disease. I'm not so good in MCQs. I'm not able to solve it.
Hi, and welcome to OneMedicine podcast. I am Dr. Srihari Kulkarni. This podcast is something special that we have to talk about in this day and age. We have a lot of MBBS graduates who are quite clueless about what to do after their MBBS, and they sort of ending up in a limbo where they are preparing constantly for MD or MS through NEET exams, and at the same time they'll sort of lose the touch of clinical medicine, which is very important for you once you even get into MD. So this is for those kind of students who should know that there is also another way, that is soon after MBBS you can have private practice. So we have Dr. Aeka Sharma with us here today, and she is into private practice from a long time, and she is going to give us insights about her struggles and give us advice about how to have a good private practice after MBBS. Hi, Dr. Aeka. Thanks for joining into the podcast. Can you let us know who you are, what you do, and where you're from?
Hi, I'm Dr. Aeka Sharma. I've completed my MBBS and Masters in Skin Aesthetics, and I'm basically from Godhra. And currently, I'm practicing in Godhra only. I have my own clinic. Also, I visit as a part-time doctor in few of the hospitals.
Tell me about your hobbies.
Okay. Um, I like to read a lot. I'm into reading, and I love to watch TV shows and movies over Netflix, Prime Video. That's all I like to do. And other than this, I like to play table tennis. I had played table tennis at the state level. So dancing and yeah, traveling, eating, so many
Wow, that's good.
things.
That's good.
Yeah.
That's a wholesome, habit list that you have.
Yeah.
Can you suggest some really good books to me so that I can read, like something that you have read recently, possibly novels or something like that?
Novels I've read only two or three, I guess. And one of them was very nice. Alchemist. I would suggest you to read Alchemist.
All right, so we have a good book recommendation called Alchemist by Paulo Coelho. That's a brilliant book. I definitely recommend that book to everybody. It sort
So
of
you
gives
have
a
already
meaning.
read that book?
Definitely, I've read that book. It
Oh,
sort of gives you a
I
meaning to
read
the
it three
life.
times.
Wow, that's nice.
I actually love that book. That's why.
Yeah, that's one of my most played audio books also. So I've read the book,
Yeah.
but I like the narration more. So I like to listen to that whenever I'm driving and going to the gym, and basically whenever I get free time to listen to it. That's the go-to book for me to read. I mean, to listen also. It's something that you, no matter how many times you read, you will not feel satisfied with it, and you get to learn a lot from that book. Like every time you read, you realize something. You have an epiphany every time you read. So that's
Yeah.
a really good book. So
Watch
what
anything.
TV series do you recommend? Like something that's really good.
If you're into comedy, then you should. I think each and every, TV series fan must have gone through Friends. So you should go through Friends once in your life, I think. And
Sadly, I'm not a big fan of Friends, but
oh my God. Then you should go for like if we are into medical, so we will love Grey's Anatomy. That's the OG, I guess. Grey's Anatomy is a very nice TV series.
I've also not watched even The Good Doctor. Yeah, I've not watched Good Doctor. I've not watched Grey's Anatomy. Nothing.
Good doctor is like, so much. Can I use one Hindi slang?
Yeah, of course.
बहुत ज्यादा वो फेक रखा है फेकू you know
Okay. Uh-huh.
that doesn't
Uh-huh.
happen in real life. He is actually
Right.
scanning everything into the patient's tummy. Like, I don't know, okay, if it really happens in real life, if any doctor assumes and play like this and that, like.
All right. Okay. Yeah. I mean, I've not seen the TV series, so I don't know. I can't comment on that. But maybe that's a good watch, is what you're recommending. So I'll definitely look into that. Yeah. What did you like about MBBS? Did you, first of all, were you forced into getting into MBBS, or did you like
No, not at
being a
all.
doctor?
Not at all. No, I always wanted to be a doctor only since I remember. Even when I was very young, like 4 or 5 year old, that time also, whenever anybody used to ask me, Beta, what do you want to become when you will get older? So, not older, younger. So, so I used to tell them that, yeah, I want to become a doctor only.
How did you choose to go ahead with a master's rather than mainstream MD? So what made you decide on that?
Yeah, so unfortunately, due to extremely high fees associated with pursuing a PG in dermatology, I couldn't immediately opt for my preferred branch. So around that time, one of my colleagues who used to work with me told me about a diploma course in skin aesthetics, being which was being offered by a reputable university. So rather than letting time go to waste, I choose to enroll in that course so that at least I can, begin my journey in the field of aesthetics. So as I delved deeper into that course and started learning the nuances of skin aesthetics, I realized how much I actually enjoying in this field. So that initially, that was a turning point for me. So it gave me both clarity and direction. So that's why I decided to, stay committed in this path only. And later I upgraded it to the master's course.
So did you do a background research about this course, or did you just join based on somebody's recommendation?
Um, no, I joined it based on somebody's recommendations only.
Okay. So do you regret doing this course? Do you feel that you should have taken the other path and
No,
pursued
not at
your
all.
MD?
I'm the happiest girl right now. I have no emergencies. I can sleep peacefully. I'm very happy right now.
Yeah,
Yeah.
that's something that all the doctors are worried about. So you experience that
Yeah.
in your internship, and you extrapolate that throughout your life, and think that this is how this is how a doctor's life is going to be. So
Yeah.
you sort of make peace with that by the end of your internship, but then you will realize that PG is much more difficult. So that is what happens with most of the people. But yeah, having a good work-life balance is something that one should really strive for. That is what matters at the end. Yeah. So your
Yeah.
family is more important than anything else that you
Important.
have.
Yeah.
Right. So you mentioned about the private practice, right? So how did you pick on the location of private practice, and how did you decide that you want to do private practice only and not join, a full-time job somewhere?
Kinesthetics basically gave me a perfect blend of science and creativity and patient care as well. So I realized I didn't needed a designation to prove my worth. I needed skills and results and of course right intent. So starting my own practice allowed me to shape my path and treat patients on my term. I don't have to work under anybody if I'm into my own private practice.
You brought up actually a very important point: the independence of practicing by yourself,
Yeah.
your decision making that does not depend on somebody else's approval, is something that everybody should understand the importance of that. Because in the longer run, I feel, as long as you're independent and you treat the patient by yourself, you will not have that sort of burnout. But if somebody else is constantly sort of micromanaging you and staying on top of your prescriptions and double checking everything, then that kind of makes you feel that you have sort of a self doubt, and you won't be able to treat patients
Burden,
also.
you feel like you have some kind of burden continuously going on you.
Yeah. So
Right.
have you experienced that ever?
Yes, of course. After I completed my MBBS, I got into the government job. I worked as a emergency medical officer for 1.5 year, 1.5 or 2 years. And after that, Corona happened. So I took a break and I was actually studying and was trying to get into MDMS, but later um, I got into aesthetics only rather than wasting the time, as I was not able to. I knew that I'm not going to get into dermatology. That's why, because of the high fee structure, of course.
Right. So the economics of it is what made you feel that it's
Yeah.
not the best choice for you. Yeah, it kind of makes sense because most of the people who end up doing MDMS are the ones who actually have a really good financial background. Sadly,
Yeah.
unless you are super intelligent, where a very small proportion of the seats are there for in the government quota and probably get a free seat there. Even the free seats are charged a lot in many states, and you have a lot of bonds and all of those.
And I knew
Yeah.
my
So
weak point.
okay, and what was that?
So, yeah, I'm not so good in MCQs. I'm not able to solve it.
Okay, okay, right. So, how did you choose about the location of your private practice? So, do you have any tips on that?
Um, I actually wanted to stay with my parents only. That's why I prefer to, practice in my own town until I get married.
What about the place of your practice? So, did you choose a particular place? Did you do a site visit before you opened the clinic, and what was that?
Um, no, I randomly opened only. I was looking for a place, but it was actually occupied by somebody else. But as soon as they left that place, I got it. I was looking for that place from last 1 year only. I was waiting, but yeah, one day I got that place.
Right. So, you were waiting, and the moment you got it, you just jumped and
Yeah,
decided that you are going to
actually.
open a clinic.
As soon as I opted for that course, I started looking for some good location so that I can practice as soon as my course gets over.
Okay, so you forethought about it. You wanted to open a clinic and you wanted to have a private practice from the beginning, from the
Yeah,
moment you joined your masters. That is a very good
masters.
intent that you had. So, how did you decide on that particular place? So, were there any factors like the traffic and any other things that you took into your consideration before you decided on that place, or what was it for you? What was that? What was the main thing that drove you into opening the clinic in that place itself?
I had never thought about this thing, I guess. Randomly only. But I think people should definitely look for a place which already have many hospitals in that area, in that location. So that would definitely makes easier for you to get more patients because people keep visiting in hospital like areas where there are so many hospitals. So if you open your clinic or your hospital in an area which already have so many hospitals, so that just makes easier for you. And marketing plays a very important role then again.
Okay, in this time, from the beginning till now, what sort of growth have you seen in your clinic?
So when the first patient came, I got totally blind at that time. When, she told me that she is facing some hyperpigmentation issue, which is basically known as melasma, the pigmentation on your cheeks, and which is basically because of, high sun exposure and stress. So I still remember I got totally blank. What should I tell her? How should I treat her? What should I suggest her to go with? I had so many things going on in my mind at that time. So yeah, but then she told, um, she actually helped me a lot. Then she told some of her known um, people, and then yeah, people just start coming like this only.
I still remember the day I started my clinic, I had only one patient that day, and I was really happy that I had that patient because that was an area where there were absolutely no doctors and nobody knew that a clinic can exist in such a location. I started in such a small road, And over the last couple of years, I have seen a really good growth. Now I have an I have an OP of around 20 to 25 ish in a day, which is a decent
That's
number,
great.
right? According to you, what is the minimum number of patients, outpatients you want in a day for you to have a sustainable income from that?
Yeah, more than 20 to 25 patients because I need 20 to 25 minutes for one patient. And as you know, I'm into clinic now for like 3 to 4 hours only. Earlier, when I used to sit whole day, that time I used to get pretty good patients. But as I started, um, to go to another hospital, so patient exposure has been decreased a lot since then.
All right, so there's one more question that I want to ask. So you may feel at one point that you are not an MDs, right? So you're not an MD dermatology, and you're doing masters, and you've done masters. So when you're treating the patients, you won't be able to treat them to the fullest. I mean, at least in the initial stages, right? So what were your referral threshold? Like, at what point did you decide that okay, this is where I have to stop prescribing medicine for this patient, and I have to send the patient to a dermatology specialist so that they can handle it, or any other subspecialties for that matter? So when, at what point did you decide that this is where I have to refer them?
As a MBBS doctor, I can treat each and every kind of disease. I'm eligible to treat each and every kind of disease. But um, I refer patients when, I get patients of skin cancers basically, or vitiligo patients, because I think they need expert opinion on that thing because it's not included in aesthetics. And I'm more into, cosmetology and trichology kind of thing. That's why.
Okay, so if there is a clinical dermatology case, you would want to consider
Yeah.
referring such patients.
Yeah. It's
Okay,
better if
okay.
they get their treatment from a qualified MD dermat.
All right, okay. So, how is the competition in small towns and cities, where the kind of place that you are practicing right now? How is the competition for you, and how you have tried to sort of improvise and innovate in your clinic?
Yeah, there is competition in small cities. So many people over here in small town um, provide you the treatment at a very low cost. So that is kind of a thing which makes it difficult for a doctor who is well qualified and is not able to charge that much because he or she won't be getting so many patients because of that thing. Some of my colleagues have also faced an issue where they have been given notice by a dermatologist. Some people, get their PG degree from another country, which is not valid in India, and then they add MD after their name. So, which is not cool, definitely, but till you are not, adding dermatologist after your name, it's okay for you to practice. You can write you are a aesthetic physician, you can write you are a cosmetologist, you can write you are a cosmetologist and trichologist.
So, have you faced any difficulty in treating a challenging patient where you lost your mind while trying to kind of explain the same thing again and again to the patient, and the patient doesn't understand?
Yeah, old people with fungal infection because they once they stop taking the medications, they stop following the routine as well. And I have a different kind of treatment plan for every patient. The difficult thing is, as soon as they, start seeing the result, they stop taking the medicines. They try not to complete their full medication course. And in skin, you are into medicine, so you are also very aware about this thing that everybody needs to complete their medication course, which is a 1 month, which can be a 1 month or 2 months or 3 months. So as soon as they stop taking the medications, they come back to my clinic. Madam, ye to, in I'm here in Gujarat, no? So people in patient language, they are like, Madam, આ તો પાછું થઈ ગયું. હવે શું કરવાનું?
Okay,
You
I
know?
didn't understand
So
one bit of that, but what does it say? What does it say?
why is it happening again and again?
Yeah, I mean, I do see that quite often, especially with antibiotics. So people have
Yeah.
that scare that, antibiotics are bad. But
Yeah,
certainly antibiotics are bad if you are going to use it unnecessarily, but when you need it, you have to use it. And
you
when you
have to take it.
prescribe, yeah, and when you prescribe and you explain it to the patients, it is so difficult for you to make them understand that you have to complete the course. So you, for
Yeah,
example, you give it for 5 days, and the other medicines take care of the symptoms, and they do it for they take the tablets for a day, and the moment they are okay, they stop the medicines, thinking that they'll have
yeah.
side effects because of the medicines. But what they don't understand, and what I've so many times failed to make them understand, is that it's important for you to take the medicines and complete the course, and if you don't, the effects of it are much more significant and
Then you
scarier and
probably become
riskier.
resistant to that antibiotic or
Exactly,
any
yeah.
other medicine.
That is true. I have seen a lot of antibiotic resistance cases, even in
Yeah,
the community, even without a single visit to the hospital, and yet people do that. That's quite often.
the most common thing over here is, low awareness and skepticism, high skepticism, because people are not very much aware about the clinical aesthetic kind of thing. That they are like, ये करवाना जरूरी है. Is it like that important? Do I have to go through the procedure to look good, to look better, to look young? So yeah, and will this thing have any kind of side effects? How frequently I have to visit to your clinic? How much I have to keep spending on my face every day so that I can look good, I can look better? So these are some of the questions which I usually get from some of my patients. Same kind of people who are not into taking medicines which we usually prescribe them will eat continuously keep eating Ayurvedic and homeopathic medications for months, for years. They keep eating such kind of medicines, without any label, without any proper description about that medicine. And I don't think like I don't know what to tell to such kind of people, because they think that taking homeopathic medicine is far better than taking allopathic medicines.
Yes, I mean, we can't compare alternative medicines there, but certainly, you do have a good evidence base for allopathic medicine. That is definitely something that people find
Each and
difficulty in
everything, yeah,
understanding.
we have this physiology of each and every medicine.
So, what advice would you give to a fresh MBBS graduate from your point of view?
Yeah, so don't panic if your path looks different from, your fellow mates. So you can also go for diploma, fellowships, and you should first of all start listening to yourself first. You don't have to go through all the societal pressures, because everyone has to tell you something only. Nowadays, uh, if you have gone through my LinkedIn profile, then you must have read that post
Hmm.
MBBS,
Yes, yes, I
just
have.
a MBBS. So, yeah, it's not a degree, it's not a thing which you have, just went to a shop and brought it. You have worked hard for 5 to 5.5 years, and you absolutely can treat any kind of patient. You just have to um, be proud of yourself, and of course, you have to try for MD and MS for a good future. But if you don't get into MD MS, then you should not be depressed. You can go for other courses as well, which definitely are diploma, fellowships, and one which I have done, aesthetic medicine course. If you want a good, happy life, work-life balance, and non-emergency kind of thing, I think it's very important to be kind and should have empathy towards their patients. You should be nice and well behaved with each and everyone. Although they are our patients, we have this thing that we can't be friends with our patients. But the thing is, you can be kind with them. You should be understanding. You should be a good listener, and you should also be a good explainer. You have to explain them what they are going through.
Okay. So tell us something about your hospital. Like, how was it?
Amazing. Who doesn't love their UG life, medical life at med school? Yeah. There was one thing, there was a ritual which we developed actually, that no matter किसका बर्थडे है, हम सबको बैच को इकट्ठा होना है, like we have to gather at 12 midnight and we have to celebrate that person's birthday together only.
So the entire batch. That would have created a
Only
lot of
girls,
noise around the
girls
hostel.
only. One of my community medicine professor caught me eating khakra into the class. I was very hungry. I missed my breakfast, and we had this community medicine class earlier in the morning at 8, and I was very hungry. So my best friend, my roommate only, she told me, Apeksha, please don't eat right now. He's looking at us. There were very few people in the class, and he all of a sudden came. I was continuously eating. I was enjoying my khakra because we all came back from home few days only. It's been few days only. So I was very happy and I was hungry. Also, I was very hungry, so I was eating happily, enjoying khakra under the bench. I was like this, and all of a sudden he came and he was like, "Madam, which topic? I, what was the topic we?"
Okay.
Yeah. He caught me eating khakra and he scolded me very bad in front of the whole class.
I'm pretty sure everyone has such funny moments in the class. Yeah, that's kind of stereotype of what a doctor or what a medical student's life is. But yes, we do see such classic examples in class. Yes, I also
Yeah.
remember getting thrown out of class just because I was talking to, my friends, and we happily moved out of the class. So we wanted to go out of the class. That was our opportunity. So we had this 80% attendance thing. I'm pretty sure you also had something like that. So back in that time, 80% attendance. So we used to calculate. So we can bunk these many days, and we can, we had a sort of Excel sheet data analysis kind of thing, and we have bunked so many classes. We are going to keep 10% as buffer. So this is what we are left with, and we used to bunk those many classes. We had that much of headroom to roam around, and that was super fun in the UG. It was so
Yes,
much
the
fun.
UG life
But
was
PG sort of
amazing.
becomes a very serious kind of a thing where you are by yourself, and you are in the constant process of learning, and you have patients who are being treated, and you are fully responsible for so many of such cases. So at one point you will become very so much involved in that you probably even stop thinking about enjoyment in life. So you will be so much focused on patient care and patient care alone. I think that kind of training is needed for everyone, so that people are a little more serious, a doctor are a little more serious about the patients. I mean everyone is, but yeah, that can happen. So that was really amazing talking to you, and it was really nice to have you on our podcast. I'm pretty sure a lot of our listeners would be more determined to open a clinic or have a private practice after they listen to you. And I believe the most important message so far is that MD and MS are not the only ways to proceed in life after MBBS. So there are various other opportunities, which is one of the important goals of the podcast, actually. So when I started the podcast, that is what I thought. If all the MBBS students and uh, the future doctors should know the various options they have, and I try to sort of pick these kind of guests who have done unique things in their life, and not just mainstream MD or MS, and that too not in mainstream subjects. So sort of go from there and build on it. And so thanks for actually coming to the podcast and explaining that to us.
Thank you so much, Dr. Shriyari.